Okay, good morning, everyone. So today we'll be talking about glucosamine and chondroitin sulfate in the knee. I'm Dom, and I'll be presenting with Rob and Jill. So our main question was, what is the role and effectiveness of glucosamine and or chondroitin sulfate in knee osteoarthritis? For our first study, we looked at the clinical efficacy and safety over 2 years use of glucosamine, chondroitin sulfate, their combination, celecoxib, or placebo taken to treat osteoarthritis of the knee. So a little background of the terms. Osteoarthritis is excessive collagen degradation. We are looking at two potential supplements known as glucosamine, which is an amino sugar present in joint and cartilage, and this can potentially have the benefit of hindering collagen degradation, which can help slow the progression of osteoarthritis. Another supplement that naturally occurs in the body is chondroitin sulfate, which is present in joints. And this supplement is usually combined with glucosamine to slow the progression of osteoarthritis. So these are potential new supplements that can be used compared to the conventional medication of NSAIDs, more specifically celecoxib. Although these may be effective, it's shown that they can increase the risk of adverse events, especially when the people taking this medication tend to be older individuals. So they're looking to see if potentially these newer supplements may be a beneficial addition. So the purpose of this study was to examine the effects of dietary supplements of glucosamine alone, chondroitin sulfate alone, or either combined with celecoxib on pain associated with knee osteoarthritis.
The study consisted of a total of 662 participants that were at least 40 years old. They were included if they experienced painful osteoarthritis for at least 6 months. This was determined by the radiographic evidence with a Kellgren and Lawrence grade of 2 or 3 rated radiograph in the index of the knee. This was a 24-month double-blind placebo-controlled study. Subjects were randomized into 5 different groups. The treatments included glucosamine hydrochloride, sodium chondroitin sulfate, a combination of those two, celecoxib, and a placebo. There were 2 main outcomes of this study. The primary outcome measure was the number of patients who attained a 20% decrease in their summed Western Ontario and McMaster University's Arthritis Index Pain Scale over 2 years. And the second outcome measure was relating to the actual amount of pain reduction attributable to each treatment. It also focused on the likelihood of achieving outcome measures in Rheumatology or Osteoarthritis Research Society international response over 2 years. Patients were monitored for the case of adverse events throughout the studies. They were asked an open-ended question for each check-in, which collected that information for us. And the information that was collected was assessed using the Food and Drug Administration guidelines. And they were monitored through vitals, blood counts, serum glucose, aminotransferase, creatine, partial thromboplastin time, and urinalysis.
All right, so the overall results for all groups saw that there was a decrease in pain over the 2 years. Most of this decrease in pain was acute. As you can see, most of the decrease was decreased in the first 18 weeks, with the quickest recovery being Celebrex. However, Celebrex was not statistically different from any other groups. And in fact, all the groups were not statistically different from anyone else, especially since the placebo was the second highest in terms of reducing their pain. Some participants saw some adverse effects, but that was due because of their underlying health conditions. A lot of the patients were overweight. They have had osteoarthritis for a long time, and that could have been another outlier that could have caused myocardial effects. So the overall objective of this study was to reduce pain according to the WOMAC scale. And like I said before, most participants were overweight with a BMI of over 30. Most people were elderly over the age of 57, and most of the participants were women. All 3 of these are kind of the triad for osteoarthritic pain and osteoarthritic disorders. And the use of any supplements did not increase pain. So that's another thing about it. By using these supplements, it did not increase their pain at all. The study is scale dependent, meaning like if you use the WOMAC scale, it could be different if you use the Lunest scale, which is another popular pain scale used for this. So overall, it concluded that all therapies were generally safe over the 2-year period, but they weren't really different from each other. So it didn't really matter which supplement you used. And even a placebo, you could have done nothing and still would have been fine. I would have liked to see maybe more research on like like the other adverse effects, they did blood pressure checking, they did urine analysis. Maybe I would have liked to see something like if how much of the supplement was actually absorbed into a body rather than excreted from the body. So
To answer our original question, what is the role and effectiveness of glucosamine or chondroitin sulfate in knee osteoarthritis? According to Swatsky 2010, supplements did not significantly change pain or function in OA patients, but combination of glucosamine and celecoxib had potential. So for our next study, looks to examine the symptom improving effect of glucosamine hydrochloride, chondroitin sulfate, and quercetin supplement in patients with painful knee osteoarthritis. Quercetin is a flavonoid that naturally occurs in fruits and vegetables and has been shown to have antioxidant and anti-inflammatory properties. So for this study, there was a total of 40 subjects, 7 males and 33 females. They were around an average age of 57. The 40 people were split up into 2 groups, 1 control and 1 supplemental. Before the study began, each participant was evaluated using the JOA criteria, Japanese Orthopedic Association criteria, and pain visual analog scale to determine whether their symptoms were severe enough to participate and be included in this study. For the JOA criteria, it looks at walking ability and pain, ascending, descending ability and pain, range of motion, and joint swelling. As for the pain visual analog scale, there's 3 subscales that look at pain at rest, pain in walking, and pain in ascending and descending. These values were also used during the actual study to determine functionality and pain within the participants. Each value was taken at baseline, week 4, week 8, week 12, and week 16. For the supplemental group, they were asked to take 1 dose of 6 pills 1 time a day for 16 weeks. The supplement itself included 1,200 milligrams of glucosamine hydrochloride, 60 milligrams of chondroitin sulfate, and 45 grams of quercetin glycoside. For this study, they found a significant increase in the JOA criteria for both the walking subscale and ascending descending subscale by week 12, and then continuing into week 16 for the supplemental group. Is actually positive because an increase in the JOA criteria means that they had less severe symptoms of OA. They also saw a significant decrease in pain in walking by week 16 for the supplemental group. Now, although this study itself did not look to study the mechanisms behind this, past research speculates that glucosamine hydrochloride may inhibit the synthesis of nitric oxide and interleukin B, which can help prevent cartilage destruction. Chondroitin sulfate inhibits the production of synovial cells of pro-inflammatory cytokines, which helps ease inflammation within the joint. And quercetin itself, again, has anti-inflammatory properties. So the combination of these 3 in the GC2 supplements changed pain and function in OA patients with no adverse effects, potentially because of their anti-inflammatory properties of all 3 ingredients.
okay, this is the study that I was responsible for, glucosamine, chondroitin sulfate, and then 2 in combination. So basically the main purpose of the study was to evaluate the efficacy and safety of glucosamine, chondroitin sulfate, and the combination of the 2 for the treatment of pain due to osteoarthritis of the knee. So the methods was very similar to our overall study that we all did. However, my study had almost 2,000 patients, most of which were women. And in order to participate in the study, they had to have pain in the knee for over 6 months, and they had to have radiographic evidence of a grade 2 or grade 3, which is a total tear in the knee. Excluded individuals with other underlying history of trauma or other coexisting pain across the body. So the patients were separated into 5 groups: 1 for chondroitin sulfate, 1 for glucosamine, 1 for a combination of both, 1 for Celebrex, and 1 for the placebo. The treatment was taken daily over the course of 24 weeks. That was the biggest difference from the previous study. The study was much more acute. They looked at pain over the course of 4 times at week 4, 8, 16, and 24, and they still used the WOMAC scale for pain. So as a result, at the end of 24 weeks, they saw overall decrease in pain over all groups, starting with from week 4 to 24. So as you see on the graph on the right, the rate of primary response percentage, that basically has to do with if they had a 20% decrease in pain, they basically had an increase of score over that time. And as you can see by the graph, they all had an increase in pain relief. Even the placebo had a group. But it's good to note that all groups were larger than placebo, primarily the Celebrex group. However, they were not statistically different from each other. So how it answers our question, the role effectiveness of glucosamine and chondroitin in osteoarthritis. So chondroitin sulfate and glucosamine used individually and in combination did not see a significant decrease in pain when compared to Celebrex or a control, but it could still be used to reduce your overall decrease in pain. It's better than using nothing.
The article that I chose was titled Combination Treatment of Chondroitin Sulfate and Glucosamine Sulfate Shows No Superiority Over Placebo for Reduction of Joint Pain and Functional Impairment in Patients with Knee Osteoarthritis. The purpose of this article was to determine the effects of chondroitin sulfate and glucosamine sulfate in individuals with osteoarthritis, and they hypothesized that the treatment would have better effects than a placebo. The methods are similar to Rob's and our main article. There were 164 subjects, and they were included if they were diagnosed with osteoarthritis, according to the American College of Rheumatology. They had to be diagnosed with grade 2 or 3 osteoarthritis with moderate to severe pain. Subjects were excluded if they had a BMI over 35, have concurrent arthritis, or coexisting disease. The study design was a randomized, double-blind, placebo-controlled clinical trial with parallel groups. The treatments included a combination of chondroitin sulfate and crystalline glucosamine sulfate, and that was compared to a placebo drug, and this went over 6 months. The main results included that the CSGS treatment had a higher number of dropouts than the placebo, and there was a greater reduction of pain in the placebo group at 6 months than in the treatment group. And the main findings from those results were that there was no significant difference between the CSGS group and the placebo group, and the treatment was not effective in improving pain and function in the individuals. And that answers our main question by saying that the utilization of chondroitin sulfate and glucosamine sulfate were not effective in improving pain and function in patients diagnosed with knee osteoarthritis.
That is our study. So overall, results have been really different between all different kinds of articles. So it may have been better to look at a meta-analysis, but as of right now, it really just depends. And I think further research needs to be done. Thank you for watching our presentation.